Today we are going to learn that is a parathyroid gland. There are four small parathyroid glands which are situated on the posterior surface of upper and lower pole of thyroid gland. Just go through the picture. From the picture, you can see where the parathyroid gland is situated. Here, from the picture itself, the superior parathyroids are there. There is a one superior parathyroid gland is present on each side. That is near the middle of the posterior border of thyroid glands. Second one is the inferior parathyroids. One inferior parathyroid gland lies near the lower pole along the posterior border of the thyroid gland on each side. Out of the four, number 2 lying on each side, they are lentiform in shape and resemble in size of a split pea. That is each measure around 6 millimeter long, 3 millimeter wide and 2 millimeter thick with a dark brown color. Now there is a histology of parathyroid glands. The parathyroid glands are composed of mass of epithelial cells. The cells are two type. The first one is the chief cells and second one is the oxyphil cells. Chief cell which secrete the paratha hormone or parathyroid hormone, that is the PTH. Oxyphil cells are larger in size with an abundance of granular and darkly staining cells. Their number increase with age. Paratha hormone is a protein in nature having a 84 amino acid. Its molecular weight is 9500. Its half-life is very short, that is the 10 minutes. The normal plasma level of parathyroid hormone is about 1.5 to 5.5 nanogram per deciliter. Here the degradation of the paratha hormone is 60 to 70% of the parathyroid hormone is degraded by Kupffer cells of liver by means of protein lysis, and the rest of 20 to 30% parathyroid hormone is degraded by kidney. Then the rest of the PTH is metabolized by other organ. Then function of the parathyroid hormone. Parathyroid hormone maintain the calcium level and it also control the phosphate level. This effect is produced by the following mechanism. The first one is mobilization of a calcium of bone into extracellular fluids. Here how it is happen means, here how the mobilization of calcium of bone into the extracellular fluid means, here the osteoclastic activity in the bone causing the bone resorption and transfer the bone calcium to the extracellular fluids. Here second mechanism is increased reabsorption of a calcium in the distal tubule of kidney, and it is also decrease the reabsorption of phosphates. That's why the paratha hormone have an important function is to regulate the level of the phosphate also. The third mechanism is increased absorption of a calcium from the upper small intestine. In addition to the above function, the parathyroid hormone also increases the formation of 125 dihydroxycholecalciferol. This is the activated form of vitamin D. Regulation of secretion. The secretion of parathyroid hormone is not under nervous or hormonal control. When calcium level in the plasma decrease, the secretion of the parathyroid hormone is increase. When the calcium level of the plasma increases, the secretion of parathyroid hormone decrease. So the next one is the disorder of the parathyroid gland. The two disorders are there is a hypoparathyroidism. It is characterized by decrease in serum parathyroid hormone level. Here the main cause of hypoparathyroidism is, first one is the surgical removal of parathyroid gland, then autoimmune disease, removal of the parathyroid gland during the surgical removal of the thyroid gland. That means sometimes thyroid gland is removed, along with this parathyroid gland is also removed from the body. Deficiency of receptor for parathyroid hormone in the target cells. This condition is called as a pseudo hypoparathyroidism. That means in this case sufficient amount of the parathyroid hormone is secreted, but the receptor for the parathyroid hormone is deficient in the target cell. That condition is called as a pseudo hypothyroidism. Then hypoparathyroidism produce definitely hypocalcemia, that means decrease in the calcium serum level, which leads to tetany. This occurs when the calcium serum level is below the 50% of the normal value of the calcium. Usually the normal calcium level in the serum is 9.5 is the milligram per deciliter. So the level is below the 6, then the tetany is caused. Here tetany means it is an abnormal condition characterized by the violent and painful muscular spasm. What is the spasm? The spasm in the sense here it is an involuntary contraction. This occurs due to, that means increased or hyper excitability of nerves and the skeletal muscles that lead to the spasm. Here tetanic muscles spasm first appear in the hands and feet. Here the laryngeal spasm is the another symptom of hypoparathyroidism, which is characterized by the rise in the sound during inspiration. It is called as a laryngeal stridor hyperparathyroidism. Already we discussed about the hypoparathyroidism. Hypo means decrease the calcium level in the serum. Hyperthyroidism, it is characterized by the increased parathyroid hormone level in the blood. Physiologically, the parathyroid hormone secretion is increased during the pregnancy or lactation, but some pathological conditions, that cause the hyperparathyroidism. That can be the primary reason due to the tumors of parathyroid glands, that is a cancerous condition. Secondary reason, that is due to the renal disorders, rickets, that is vitamin D deficiency, etc. Then hyperparathyroidism produce osteitis fibrosa. It is characterized by the decalcification of a bone. As we know, if the another function of the parathyroid hormone is mobilization of the calcium from the bones. So definitely there is a decalcification of bones is occur. That bone become, as a result of the decalcification, bone become abnormally weak and deformed. Due to the decalcification, usually if you take the X-ray, you can see large punched out cystic area on the bone. Then hyperparathyroidism result in hypercalcemia. That means the hypercalcemia in sense, normally we know the level of the calcium in the serum. If the calcium level reaches 17 milligram per deciliter, become lethal. The signs and symptom of hypercalcemia, that is the depression of a nervous system, lack of appetite, then constipation, peptic ulcer and abdominal pain, etc.